My name is Jackie Orton. I represent WNMU's Social Work Department in beautiful downtown Silver City near the Gila National Forest in New Mexico. I'm here to present a pharmacological treatment of an elderly patient being prescribed Ativan to address anxiety and dementia with relevance to her treatment plan. She currently resides in an assisted living facility for 1.5 years from having a fractured hip due to a fall on the sidewalk. The patient suffers from severe psychological issues which have resulted in organic mood disorders complicated by mental illness. Comorbidity includes bipolar and depression, not otherwise specified diagnoses. More recently, the patient has been diagnosed as having senile dementia, which will be the focus of the medication being prescribed for this patient. Ativan is being prescribed to reduce this patient's agitation. The psychopharmacological treatment and use is that Ativan affects the chemicals in the brain that may become unbalanced, which cause anxiety. Therefore, it is used to treat anxiety disorders. This medication is in the drug class known as benzodiazepine, which act on the brain and the nerves of the central nervous system to produce a calming effect. The drug works by enhancing effects of a certain natural chemical in the body called GABA. The rationale behind using Ativan is that it is shown to have calming effects with the reduction of outbursts when taken. While dementia is marked by such cognitive deficits as disorientation, memory loss, and changes in intellectual functioning, in the middle and later stages of the illness, as many as 50% of the patients with dementia will exhibit agitation. Of approximately 4 million people in the United States who suffer from dementia, 70% will become psychotic within the first 6 to 7 years of the illness. The relevance of treatment for the use of Ativan for this particular patient's treatment plan is supporting the reduction of aggression and outbursts and agitation that the patient is experiencing. She exhibits behavioral disturbances, including mild aggression, combativeness, and frustration, resulting in verbal outbursts and cursing. The patient is unable to control these, and this is causing significant harm to the staff and the residents of the facility. The patient had been living independently, but further exacerbating her condition now is dementia. And while dementia is marked by such cognitive deficits as disorientation, memory loss, and changes in intellectual functioning, the precipitation of senile dementia is causing the onset of the patient's agitation and anxiety. The term agitation refers to the range of behavioral disturbances including aggression, combativeness, shouting, hyperactivity, and disinhibition, which more importantly are the symptoms of agitation such as uncooperativeness with receiving the necessary care, motoric hyperactivity, and verbal abuse. The nonspecific neuropsychiatric symptoms of agitation can generate feelings of frustration, fear, and helplessness in patients, caregivers, and the staff providing medical care. Coping mechanisms may fail with demented people. Having lost their mental powers, they may not be able to communicate their exact problems. Some caregivers may see the affected elderly people as manipulative rather than as victims of an unavoidable central nervous system change. Ativan may contribute to lessened agitation. With regard to the medication class, the functioning and side effects, basically what to expect with this drug, is it is known as a benzodiazepine. It is sometimes known as lorazepam, alprazolam, chlordiazepoxide, which is known as Librium, clorazepate, which is known as Transine, and diazepam, which is known as Valium. The functioning and side effects are primarily drowsiness. It can be habit forming, and you're not to take Ativan if you have an eye condition called acute narrow angle glaucoma, which is basically high blood pressure in the eye. Additional side effects include sedation, amnesia, confusion, and paradoxical responses that may be incurred, which can intensify the cognitive slowing and producing changes in equilibrium. There are withdrawal symptoms, particularly if the patient goes into a hospital or nursing home and the patient has not revealed that he or she has been taking this medication or other medications in conjunction. There are also certain drug interactions, and one is to be extremely cautious in reference to allergic reactions of lorazepam or any other benzodiazepine. One important disclaimer as well is that when a patient is pregnant, taking Ativan increases the effects of alcohol. My role in supporting the client through the medication trial is threefold. I will be supporting the client, the family, and the staff with any knowledge obtained regarding the disease, and I will work it in tandem with the providers, especially when dealing with comorbidities such as the patient represents, and the use of this Ativan prescription. I will provide psychiatric screenings, consulting with a geropsychologist, and apply therapeutic interventions for direct patient care and coordinate ongoing communications with other providers in relation to the Ativan and any noted changes with the patient. Using such depression rating scales as a patient health questionnaire, the Beck Depression Inventory, and the Geriatric Depression Scale. Also, if the patient is non-compliant, I may use the Zoom self-rating scale for depression. The geropsychologist will assist with significant emotional issues pertaining to the patient's combativeness and shouting frustrations, which will help to analyze the psychosocial aspects of the client. By providing empathetic help and assisting the client to make informed decisions regarding the history and medical benefits for treatment in relation to the course of utilizing the Ativan, this will be most important to the patient and, of course, to provide hope for the patient. Additionally, therapeutic interventions may include cognitive behavioral therapy, which will support the behavioral disturbances of aggression and outbursts. Since the patient is experiencing difficulty with planning and organizing thoughts, and at times is reflective of stuttering and missing words during thoughts, the cognitive decline may be part of the normal aging process and representative of possibly Alzheimer's or vascular dementia, and this should be monitored for these conditions as well. I will continue to reassess and evaluate the effects of the Ativan prescription and to be mindful that the possible situational depression manifestations, subtype and spectrum depression illnesses like psychosis, melancholic, anxious, and bipolar depression and its effects will also be important to monitor, since psychotic depression results in delusions, paranoia, and hallucinations. And I will keep this ongoing consult with the medical staff and providers that are administering the Ativan, and to watch for the major depression characteristics in addition to appetite, weight, sleep changes, especially marked by insomnia, patients' feelings of guilt, and expression of suicide. I will recommend that the patient maintain blood testing and psychiatric evaluations and remind staff about dementia, treatment concerns, and the various paradoxical drug interactions. Hopefully Ativan itself can provide a good case of help for this particular patient and have reduced episodes of outbursts. Thank you.